Hello, everyone. It's May 13th, Wednesday, and this is our briefing today. Just like every day, we try to announce, and we hope and pray that we don't have to announce that we've lost another West Virginian, but we have. We lost a 78-year-old male in Berkeley County. That's our 58th death so far in West Virginia, and we're surely hoping and praying every day that our 58th death is our last death. I've said so many times, it's 58 too many now. You know, these are people that we should absolutely keep in our thoughts, our prayers, and I ask you to please, send up many, many prayers and ask for the blessings of these great West Virginians we've lost and all their loved ones. Please do that. There's no point in me going through and reading to you about the reopening stuff, that you already know. It's already up on our website, and you know of everything except one thing. I never dreamed in all my life that we've gotten all these calls in regard to the tanning businesses or tanning beds. We continue to get all kinds of calls, and so I am announcing today that our medical experts now feel like we're good to go, and we're going to bring them up online on May 21st on Thursday, with a lot of the other stuff that we already had scheduled. So you'll see your guidelines and everything that'll be posted later today. But the tanning businesses will be opening back up on Thursday, May 21st. I don't have a lot to report today in lots of different areas, and that's really good. I want you to know if you're one of the businesses or whatever out there that's still still closed, I would ask that you would please try to be patient. We're working it as diligently as we possibly can. We're doing so in trying to absolutely do the obvious, and that is, no question, bring us back from the standpoint of economics and all that, but we have got to remember we really need to take baby steps in this. There's so many different programs that are out there, and I hope that you're utilizing those programs, from the stimulus programs for small business or our individuals, or the loans, or whatever it may be on Main Street loans. There's so many different things that I ask you over and over to look at and work it as best you possibly can. Just because you qualified for a forgivable loan on the Main Street division, you're also eligible there, as I understand it, for loans that are basically where you pay no interest or no payments for a year, and then the loans have to be paid off, and I think the scheduling of the payoff is in the second, third, and fourth years. But please look at that too, if that is something you'd be interested in and it could help your business. I would only say again that there's no crystal balls here. All we can do is absolutely do everything that we've already done. Consult with all the leaders throughout all the state. Absolutely depend upon our medical experts to give us great guidance. Talk nonstop to the federal government and to the president and all the different angles of everything there. Talk to great medical institutions, whether it be Johns Hopkins or whomever it may be, all across the land. This is what we're doing every single moment of every day. Now, in order to try as best we can to make the right moves on the chessboard and still know that if there's an outbreak somewhere, we'll be able to respond, and we'll be able to respond quickly. Everybody's trying to do just that, but nobody has a crystal ball. I ask you as West Virginians over and over and over to stay vigilant, to stay on top of your game, to keep making us all proud of what you've already done. Be patient. Please be patient. And I know it's hard. I know it's terribly hard. So, but I know that this will pass, and it will be something that we'll read about in the history books, and it'll be gone. It'll be gone. But we've got to give it the chance to be gone, because if we don't, along with it being gone, are going to be gone a lot of great West Virginians way beyond what we already have lost. So thank you again, and please just stay the course. You know, we've got a couple other announcements today. Is Nursing Home Week in West Virginia, and I have proclaimed that. We want to recognize more than 15,000 West Virginians who work in the nursing homes and are on the front lines fighting this, terrible epidemic and terrible disease. This week is a time that you should recognize all of our nursing home residents, but you should absolutely think about, that who their parents are, who their children are, and absolutely just stay on top of saluting and helping to recognize all the great effort that all the nursing home staffs have done. They've done good stuff, and as well as our owners, and we've all worked together. We're the first in the nation to test all of our nursing homes and everything, and we've led the way on that, and we're continuing to try to stay on top of this in every way, because we know these people are the most vulnerable of all. Now, also, this is May. The month of May is National Foster Care Month. Now, just think about this. And I can, I only have one way to speak to you, and that's just in plain everyday talk. Our foster children, for the most part, have already been dealt a pretty tough hand, and they need help. And for the over 7,000 in West Virginia, it is imperative that we continue to be able to recruit parents and people that want to step up and take care of these kids, and just it is incredibly important. This pandemic has got to be noted that it is tremendously difficult on these families, on these kids, from the standpoint that they had to stay home, from the standpoint that there was lots and lots of safe havens at schools and everything that were closed. Absolutely, the hardships of what these kids and these families are going through right this minute is magnified in multiples to what all of us are going through. So please recognize this month as Foster Care Month, and it is absolutely so important. And there's so many that are out there that are hurting. They're not invisible. We see them. I want you to see them, and absolutely just note that just how precious they are to all of us. Now, I guess the last thing that I have on my list, and like I said, it's not very big, is just this. I tell you every day about be counted in West Virginia on our census. You hear me every day tell you that. We're running out of time. That's all there is to it. And absolutely, the county in our state that has the highest number of people that have responded is Wood County. And if I were to tell you the very best county within our state, we have counted in a response of 64.8%. That's the best. That's not good enough, West Virginia. You want me to tell it like it is all the time. It's just plain not good enough. In McDowell County today, We have a response of people that have been counted of 4.7%. That's not good. That's just not good. A lot of our southern counties, really low, really low. It kind of jumps around. Pendleton County is 11.2%, but absolutely the very best that we have is 64.8%. You know, we got to be counted. It is so important. Please help me with this. Please, we have got to get ourselves counted, because if we don't, at the end of the day, you know, it's just going to pull more and more dollars out of West Virginia that we need. We desperately need, you know, and so just think about it. Just think about the flow of the possibility of COVID-19 dollars that could have come to us, you know, if we had been counted better 10 years ago, you know. So the net of the whole thing is just this. We are ranging from 4.7% to 64.8%, and what we should be seeing here now is 80s and 90s across the board. We need you, West Virginia. We really need you. I keep telling you, please, please help me get counted, you know. And so to all of our county commissioners, city people, anybody and everybody, help me. We've got to get ourselves counted, or we're just going to leave tons and tons of money on the table. My last here is just this, is I always show you our charts. You know, we went 2 days with a less than a 0.5% number on the positives to number of tests taken. Yesterday, we jumped back to 2.0%, still really good and everything, but yesterday we jumped back up just a little teeny bit. You know, overall, our cumulative number still dropped a little bit more. Now we're at 2.10. Yesterday, I think we were at 2.11. And as far as our active cases versus our recovered, that's getting much better. Now we're somewhere around 850 that have recovered, and we've dropped down to somewhere around 480 that are still active. So all that's working and all that's moving in the right direction. You know, our total amount of testing is now at 3.75. It's unbelievable, you know, the total amount of our testing per our population. You know, we're leading. The nation is at 2.9. We're at 3.75. You know, Kentucky's at 2.3. We're at 3.75. Ohio, Maryland 2.7. Ohio at 1.8. Pennsylvania at 2.3, and Virginia at 1.8, and we're at 3.75 on the percentage of population on the number of tests that have been taken. So we're testing more than anybody around us. Our numbers are a fraction of anybody around us, but now we're starting to open up more and more and more. We got to be careful. You got to absolutely be careful. Use all the guidelines. Wash your hands. Social distancing. Please take care of the elderly. I have said it until I'm blue-green. And please, please, get busy, West Virginia, and don't pitch me a number like 4.5 or 64.8 on our census. Come on, West Virginia, let's go. Just show yourself how good you are right there. Get counted, and it'll bring more dollars into us for a long, long, long time to come. Thank you so much.
All right, thank you, Governor. Now let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. As the governor said, he has proclaimed May as National Foster Care Month. We want to remind everyone that foster care and adoptive parents are still greatly needed. So we'd like to put some numbers up as I talk. Mission West Virginia works with DHHR as a neutral referral source for all foster care families. Since April 13th, our foster care inquiries, our foster care applications have increased. We're hoping that those numbers continue to climb. We want to make sure that information is available for everyone. We greatly appreciate all of our foster care families and all that they do. We thank you for that. During the pandemic, we must work to protect our children every way we can. This includes well child care appointments with your child's medical provider. One of the things that this pandemic has changed is the ability to use telehealth and telemedicine for families and for providers, and that's something that I think will continue even after the pandemic is over. It's very useful, very functional. Some elements of the well child visit can be handled through telehealth appointments, so please call your provider to determine whether those are available. If your child has become recently uninsured, healthcare coverage is available through West Virginia Children's Health Insurance Program, the CHIP program. Please look at our website online if you need services or insurance coverage for your child. Information is available on our website for that. So thank you all. Please stay safe.
Thank you, Secretary. Now let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I don't have a tremendous number of comments, but I do want to tell you that over the last 3 days, our R0 level has been 0.83, 0.83, and yesterday 0.89. Today's is not out yet, but I think it just reinforces the idea, as the governor has said, that as we continue to open more parts of West Virginia for each of our citizens, that this also has the risk of having more spread of COVID-19. And so as we look and try to understand how we come back out, and as we've talked to start the dance with the virus safely, I think the two most important issues that we really need to think about as a set of communities and as a state and as individuals is to focus on physical distancing, and we know that 6 feet is really important, and also wearing face masks or face coverings. There's an article that came out in the Wall Street Journal that said that those two elements alone could help reduce the spread of the virus, the R0 value, to make that less than 1, if people would consistently do that. And as we've talked about, the voluntary cooperation of each of you is so important. That protects you, your family, and also protects your community, our healthcare workers, and our state. And also, as we talked about yesterday, we're also understanding today that the children of West Virginia and young people of West Virginia are not protected wholly against this virus. And I don't want to scare people with that, but I do believe it's important that we not look at COVID-19 as just a disease that really affects older people or people in congregate facilities like nursing homes or assisted living homes or whatever. This is also a disease that can affect young people. And we talked a bit about this Kawasaki's, this inflammatory disease that's seen primarily so far in New York City, but it's also spread out some. So not to scare people, but just to understand that protecting each of our family members, irrespective of age, becomes really important. I also want to congratulate Major General Hoyer and his whole team. We had an opportunity to go together to the facility and see what the amazing work the Guard is doing. So it was really inspiring, and thank you for all of the people doing amazing work on behalf of all of our citizens, and as the Guard does all the time, putting themselves in harm's way to support us. So thank you very much.
Thank you, Dr. Marsh. Major General Hoyer with the West Virginia National Guard is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. I was wondering if, and this is probably a question more for DHHR, for Secretary Crouch or Dr. Slump, but they're there. I was asked by my editors about trying to get some numbers in regards to certain types of other deaths that we're seeing normally right now, heart disease, stroke, what have you, to compare with the COVID numbers that we're seeing. I didn't know if that was something that DHHR could provide online to kind of show alongside what we're kind of looking at in regards to the COVID death rate in the state, and have something to kind of compare that to. Thank you.
Absolutely. This is Bill Crouch. Thank you, Steve, for that. That most of that information is available online. DHHR publishes those data points annually, so it is available online. If there's some specific information beyond what's available online in terms of deaths by residents and age and type, we'll be happy to get that for you. But that's a good question. We're happy to provide the information for you.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS Channel 8 and Fox 11.
Thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. Question for the governor. Governor, you had mentioned a few weeks ago that small businesses had the option of insurance to where some of their policies would cover the gap in services that they're being allowed to offer. But I'm being told by, and forgive me, it's grass cutting day at the Capitol. I'm being told by many small businesses that their insurance companies are denying their claims. So is there anything you can do through your insurance commissioner to help persuade or lobby on behalf of these small businesses who have it in their policies, but the insurance companies are saying things like, well, it wasn't a flood, it wasn't a storm, there's no physical damage, so we're just not going to cover it. What kind of pressure can your office and your insurance commissioner apply?
Well, Kenny, here's basically what I said. I didn't mean if I implied that, I'm taking any side, in the situation. I'm sure that our insurance companies are doing great work, but at the same time, what I was just implying that I wanted everyone to do is just check their policies. Just go back and check their policies and, and read, triple recheck and everything, because, but from the standpoint of changing policy, with the insurance commissioner, I don't think I have any ability to do that, but what I'm saying is just this is, I do know in situations to where, as far as business interruption insurance, and that's what we're talking about, I do know in situations, that people felt like they didn't have any business interruption insurance and everything, and lo and behold, they did. But it's just a matter of just checking your policy. And really bearing down. And I'm sure you've got agents and everything that'll do that and do a good job for you. But we just, again, I'm just trying to tell everyone to don't leave any stone unturned and just check. And if you've got it, great. And if you didn't have it, well, that's unfortunate. But nevertheless, it was always worth checking.
Thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hey, everybody. I was looking at the COVID-19 numbers for Virginia today, and it looks like Loudoun County, Virginia, on the border with the Eastern Panhandle, has almost as many positive cases in that county alone as the entire state of West Virginia. I think Governor Northam has indicated that Northern Virginia will stay on lockdown at least through May 28th. So what precautions can we take to assure that people don't come flooding from Loudoun County, where everything is still closed, into Berkeley and Jefferson County to shop and eat and partake of other activities?
Well, Phil, let me make a little stab at it in the beginning, and then I would welcome our general or Secretary Crouch or Dr. Marsh to weigh in. But Phil, there's no perfect solution. I mean, that's just all there is to it. You know, we want to urge any and everybody that we possibly can. You know, that's fine. We, you know, open up our campsites, open up our campground, you know, whatever it may be, to in-state, only in-state, only in-state. We want to absolutely urge all of our businesses and everything to just stay on the watch and everything, because we surely don't want a flood of people coming over from Virginia and everything. But if they're getting ready to ease back and open up on the 28th, we ought to be okay and everything. But you know, we're watching every one of these hot spots all across the country and everything. And if we get a situation, you know, in one of the Eastern Panhandle counties and everything where we're starting to see an uptick and everything, we'll be on it, and then we'll take a more aggressive, you know, stance on that. But right now, and only to the very best of our experts and my abilities, I think we're okay right now. But we got to just stay on top of it, and we got to really, really, really watch. If you don't really have a need to go outside, why not just let this go another couple of weeks and let's see where we stand? If you're an elderly person and you don't have a real need to go out, why not just wait a little bit longer and everything? You know, why just rush out and do something that could expose yourself? And so let's just try to take it as best we can, on an honor system as best we can, and try to know, and know right behind that there's real juice if we get numbers that are starting to spike, you know, within certain areas of our state. We're going to be on it. But guys, if there's anybody else that can add something else, please do.
Governor, this is Bill Crouch. I don't think we could say it any better than that. I think the idea of individuals that are elderly or have underlying conditions should extend that time in based upon their condition. That is important.
Governor, this is General Hoyer. I think it's important to point out that we monitor numbers every day of the surrounding counties in our border areas and watch that and the trends in our counties. And as you stated, there is no perfect solution to this, but the monitoring, the surveillance, are the things that we can best do now moving forward.
And Governor, this is Clay, just real briefly, because I think everybody has stated some of the points that I might have made. But I do think, Phil, one of the important considerations as we enter this dance phase of our coming back together and learning to live with more harmony with the virus is the fact that not all parts of our state are exactly the same. And although on the first part of this, we've sort of treated all parts of the state as part of a single whole, now we understand there's 55 parts of this whole. And certainly areas like the Eastern Panhandle, surrounded by the Washington, D.C., Maryland, Northern Virginia area, is probably our highest susceptibility area, as you rightly point out. So while the governor, to me, is exactly correct that we're monitoring constantly, we're trying to do all the things we can to protect people, I think that what you'll start to see in this next phase is that there may be local issues that need to be dealt with in parts of the state that don't necessarily have to affect the entire state. So as we look at the Eastern Panhandle and look at that activity around it, we are understanding very well of the enhanced danger that exists in that area of the state. And we will be very focused at making sure, as much as we possibly can, that we are being thoughtful and safe for the people there, but also react very quickly if we see anything change.
And I want to add one more thought back to the same thing, because Clay is exactly right, and our experts, and you heard what the general said, and Secretary Crouch, and what all of our experts and everything are focused on is one thing. I want everybody to understand just this. You know, this is a one size does not fit all. You know, 55 is not 55 as far as I'm concerned, as far as all these experts are concerned. And it may very well be that we have got to regionalize this in a much more defined way. But right now, we look good. but as we move forward, just because you happen to be in one of the Eastern Panhandle counties, don't expect that if there's a real problem there that you're going to be treated exactly the same as maybe a county dead in the middle of the state or whatever. So we may very well have to change, but I want everyone to know loud and clear that this is not a one size fits all. Right now the numbers are good and we're going to ease back, but as we ease back, as we have to adjust, just remember that one size doesn't fit all.
All right, thank you, Phil. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis from Nexstar. I got an email from a viewer the other day, and at first I thought this was kind of a frivolous question. And then the more I thought about it, I thought, wow, this is a really good question, given the time of year and the nice weather that's here. The viewer wanted to know, can they have yard sales? And if so, what are the guidelines? And is there a difference between one individual holding a yard sale and a big community yard sale like the one they have every year in the east end of Charleston? So what is the guidance here?
Ooh. I think, Mark, the guidance is 25 people, and 25 people gatherings, and social distancing and all that stuff with it. But nobody's brought that question to us, and we may have to modify and come up with a better answer to that and everything. But as we go forward, we're just going to have to, be sure that if people are gathering together like that at a yard sale, wear masks. Wear masks. Please do that. But we'll get you a better answer as we go forward. That's the best answer I think I can give you, and I don't think any of our experts have had that come up to them.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I had a couple of questions related to unemployment. I know you said we've received something like north of 170,000 claims since March 16th. What does that put the state's overall unemployment rate at? What effect do you think these next couple rounds of openings will have on that overall number? And where are we at with those 15% of claims that needed special handling?
Okay, I think we've had 205,000 submitted so far, and I'm gonna have to not be able to give you every single detail of this, but we're continuing that I think this coming Thursday we're going to be able to release more information that's coming from the feds, in regard to all the situations within our claims. As far as your question about the 15,000 that were basically, claims that were submitted, but there was additional interviewing that had to take place, or questioning, or personal issues, or whatever it may be within those claims. I can't really give you an answer to that and everything, but I'll get you an answer. I don't know exactly, the status of that.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi there, Amanda Barron with WSAZ. I wanted to ask on the specific information for the guidance for counties when it comes to spikes in cases and hotspots. And you all said at the end of last week that we would have an update on the situation in Fayette County, and I was hoping you could provide us with that information.
Okay, Secretary Crouch or Clay, somebody's got to answer that other than I.
Certainly, Governor. This is Bill Crouch. Hi, Amanda. Thank you for the question. We do have that finalized. Dr. Slimp's going to make a presentation on that tomorrow. We follow all the counties, all 55 counties closely in terms of those numbers, and we've modified that the way we're doing that a little bit over time. As others have said, we kind of learn as we go along what works and what doesn't work and what works best. So we've modified that system, and we'll talk about that more tomorrow. Dr. Slimp will be here to address that.
All right, thank you, Charles. Next, we'll go to thank you, Amanda. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, yes. This question is for Dr. Marsh. I've heard a lot of concerns from citizens about the sample size and the way that we're testing. and whether or not, the fact that we're testing nursing homes and daycares and that we're getting so few positives there, that the total number of tests might be skewing the results, and that the sample size of the general population is not properly being represented. I realize that this is a question that we probably should have asked earlier, but can you explain to me the sample size that we would need to ensure confidence in these results? Can you spell that out with mathematically and give me a total number of citizens that we expect to test to get the results that we can feel confident
in? Dr. Marsh, go.
Okay. Well, Dave, that's quite a question, I have to say. I would not really be able to answer that question, nor do I think almost anybody would. We have to recognize that we are in a transition time related to testing. And I won't go through the gory details, but we've only been in this pandemic since, December, January. And so testing has really tried to catch up, and we're changing even some of the ways that we test. So for instance, right now, to do a COVID test, you do a genetic test for parts of the COVID virus. If you look at influenza or other like viruses, you do an antigen test, which is really looking at the proteins on the virus. And we've talked about antibody tests, which are something that's coming up, which tells you you've been immune. But as far as the diagnostic test, the antibody test or the antigen test, which is what we use for influenza, can be done very quickly and very accurately. And I think that's where the COVID test is going. And so as we don't have to do the genetic test, but we can do an antigen test, I think you'll see a great increase in the ability to start to test many more people more rapidly, because it's a relatively fast test that can be developed either on site or within a very short period of time in a laboratory, simpler test to do. I think that the COVID testing, as the generals talked about, is really a point in time test. So it tells you today, when you had the test done, if you had the COVID virus or not. We know that positive tests are generally positive. Negative tests, I think they're getting much better and rely on appropriate sampling and others. And so there is some inconsistency in some studies related to the negative tests. We also know there's other ways to estimate the prevalence of COVID in the population. And we also know that trying to test enough to get your rate down below 3%, your positive rate, is associated with the best outcomes in almost every place, and including countries, that's been tested. And as the governor said, our rate is about 2.11%. So instead of trying to get a sample size, because that sample size is only one point in time, because the viral test says that at this moment, when you got tested, here's your results. It doesn't tell you what might happen in a week, a month, 6 months, etc. But I think what we're doing is trying to focus on the populations that have the most risk of dying or rapidly spreading the COVID virus. And as we talked about before, just make sure we're level set, that the flattening of the curve is not getting rid of the virus. The flattening of the curve, which West Virginia people did great, is really about buying more time. And the governor said we're buying time until we can get a drug or a vaccine. So this is not a test of just seeing what the prevalence of COVID is in the state. It's really a test to try to make sure we're identifying asymptomatic or pre-symptomatic people in these vulnerable settings or these counties that have either cases that we're doing case investigation, or that have a lot of cases, as we talked about in the Eastern Panhandle, the adjacent areas of Northern Virginia and Maryland. So we want to look at those so that we reduce the risk of spread by people that are asymptomatic or pre-symptomatic. I think the antibody testing, as it becomes more available and it becomes accurate, is going to give us a better idea about what the prevalence across the state of West Virginia is. because that tells you people that have been infected and now have some immunity or evidence of immunity toward it. So that is to come. So I hope that answered the question. But I think the way that you addressed it, because that implies that there's some security by testing once that for a long term, and I think that's really an antibody test as that gets ready to be deployed.
Just a second. Let me kind of weigh in on that just 1 second, okay? And was it Mark who asked is that who asked?
It was Dave Mistich.
I'm sorry?
Dave Mistich.
Oh, Dave. Okay. Well, Dave, think about this just 1 second. In the state of West Virginia to date, we have tested 66,680 people. So the amount that we have tested in West Virginia is an enormous amount compared to all of our surrounding states. I mean, an enormous amount. In comparison to Ohio and Virginia, we have tested twice as much on a percentage basis, of Virginia or Ohio. We have tested 50% much or more on a percentage basis than the U.S. or Pennsylvania or wherever it may be. But the real key is just this. We're just testing the people that are the most vulnerable people or people that have symptoms, and yet our numbers are still really, really good. The bottom line, the way I see the whole thing, is if we all want to test more. All of us want to test more. Everybody's for that. It's just a matter of being able to get the kits and be able to get the testing supplies and be able to do more and more and more. Now, but the bottom line, the way I see the whole thing, is just this: is if we were able to just if we could just test everybody, and we want to absolutely continue to test at our hospitals and keep our numbers as solid as we can possibly keep them in that setting as well. But if we were able to test everyone today, probably our numbers would even get better and better and better, because today we're out, and what we're doing today is we're testing those that are the most vulnerable or the sickest. And so I feel like that generally the numbers are pretty respectful of most everyone, from the standpoint that on the amount of testing that we've been able to do thus far.
All right, thank you, Dave. Next, we'll go to Brad McElligott with West Virginia Metro News.
Hi, Governor. Hi, everyone. Among the sectors of the economy that have been allowed to reopen were dentist's office, and they put off collectively their opening a week beyond when government actually said they could. They were going to begin this Monday, but one of their precursors was having enough protective gear for dentists, for hygienists. Was there a state attempt to provide dentist offices with more protective gear? And do you know how that's going? Thank you.
Brad, to my knowledge, and I'll have our other experts weigh in, but no, I don't think there was an extra effort that was put on in regard to that. Of course, we always want to try to help, in every way we possibly can. But I think that the delay was, from the dental board, and I don't know exactly what the board's called and everything, but I believe that the delay was the board had set up for them to open the next week. We told them they could open a week prior and everything, and I think that's what the reason for the delay more than anything.
Governor, this is General Hoyer. There were some additional donated face shields from Toyota, as well as some donated masks that were provided to the dental board to provide as an initial start. But as you pointed out, Brad, there is still a national issue with PPE, and particularly small individual organizations attempting to gain PPE. And we continue to look from a state perspective to see how consolidated efforts can help with those. But as the governor pointed out, that we did not have any specific outreach to any sector, and those right now, and our primary responsibility from the National Guard, Department of Homeland Security, Emergency Management, and DHHR is to maintain the appropriate reserve for a surge that might occur that relates to hospitals, first responders, and law enforcement.
All right, thank you, Brad. We have time for one more. We'll go to Paul Mullen with WCBC Radio.
Good afternoon, everybody. My question is about another risk factor that we haven't talked about, I don't think, enough, and that would be obesity. And its problem, 2 out of 3 West Virginians are overweight. Maybe Dr. Marsh is best for this one. Should people overweight be doing something in addition to what the recommendations are for everybody else to protect themselves as we come out of the shutdown?
Governor, are you okay with me addressing that?
Before you address it, I'm trying real hard on my end right now and everything. So I'm working at it every day. And when I get real skinny, y'all be all of you be really proud of me.
I'm proud of you right now. So what I would say to the question, I think it's an important one. What we're finding out about the COVID infection is that, at least at this point, it tends to be more of a blood vessel problem than a lung problem or others. And because blood vessels connect to every organ, and because obesity, diabetes affects the blood vessels, the way the blood vessels react, or is associated with high blood pressure and others, that has turned out to be a risk factor. So the real risk factors, as I understand it, and this is, I remember, is from a study in New York City related to the people that had to go to the ICU, people that got even sicker. The real risk factors were high blood pressure, pre-existing, not controlled, pre-existing heart disease, obesity, diabetes, and older age. And they're really because these are blood vessel problems. And a recent study has found that one of the things that, as you look at all the experience across New York, that made a big difference was blood thinners being used for people who had COVID-19. So I think that what we're starting to understand, at least as we're seeing COVID-19 change as it's gotten here in the U.S., that younger people are affected more than we saw in China and some of the Asian European countries, that this is a disease that seems to be really focusing on blood vessels, and people with existing blood vessel problem have more risk. And this also is associated with blood clotting, and it's associated with the carrying of oxygen. We also know that some people have been basically with oxygen levels that are on the floor, sitting in an emergency room, talking on a phone, looking like that they're not even affected. So as we go forward, this disease appears to be changing from what we understood in Asia. And that's the reason why I think that looking at some of these risk factors is really important. And I think that whether you have any of the risk factors I mentioned or not, really the treatment and the prevention is the same. I would say that if, as the governor said, if you don't have to go outside, if you can stay home and if you can work from home, then you should do it. If you're going outside, maintain that physical distance and wear a face covering. And I think that if you do that well and wash your hands and don't touch your face, I think that, we can all live relatively safely with the virus and be able to open the parts of our state that are important for all of our citizens and, importantly, to get our economy started again. So thanks.
Governor, I'll turn it back to you.
Well, again, I thank everybody. I urge everybody to get really busy because we're running out of time on this census stuff, and get yourself counted, please. All I would do is echo just this. Everybody needs to understand wholeheartedly this virus hasn't gone anywhere. I mean, it's right here. It could be right on this desk. It's right here with us all. Now, what we got to do is we got to absolutely do everything we possibly can to minimize the risk. That's all we're doing is minimize the risk, push it down, push it away from us. We know that there's big time risk that if we don't ever reopen back up, we're going to get into a heck of a situation and we're going to slip into a total depression. So we've got to move that way. But in this movement, please just understand just this. All we're doing is bridging ourselves to where we get a drug that will stop this thing right in its tracks. That bridge is not going to be forever. It's just a matter of 2 or 3, maybe months, maybe 4 months. We ought to have a drug in the U.S. that minimizes this killer from a killer to maybe a bad, bad cold. At that point in time, we're way down the trail, way down the trail. So in other words, you've done such good work so far. For 2 or 3 or 4 months more, so that we don't have a total meltdown of our whole country in every way, from economic to sickness beyond belief, just stay the course. I mean, just stay the course as best you can. Live your life, but at the same time, social distance, wear a mask, please wear a mask and everything. And take care of the old, wash your hands, try to keep your hands away from your face if you can, and absolutely just use good West Virginia smarts. That's all you got to do. You've already done it and done it and done it. And so just keep at it, and we're going to be fine. But know you've got a real strike force behind you that's ready to run to the fire if we get a problem, and we'll surely do that. Thank you so much.